Desire and pleasure can change after cancer treatment due to the physical factors, the hormonal impact, but also how one feels in their own body, sometimes because of pain that can disrupt the arousal process, as an example. Emotional factors, so fear of recurrence, a disconnection with one's own body, and fears and anxieties related to your cancer journey. Relationship factors, this relates to how you feel to your intimate partners, but also your other relationships as well. And role changes in terms of your own identity. You might not be working for a while, and that shifts how you feel about yourself. There's a potential that your partner has now become your carer, and that can really impact your relationship and the dynamics there. There can feel an inequality in that, and sometimes that can affect how you might feel as a sexual person towards them and that sexual relationship. People can work towards a reframing of their desire and their interest and their pleasure, rather than thinking it's gone, it's lost. We can do this in lots of different ways. We might want to consider how people communicate their ideas around what might feel enjoyable and pleasurable now. That might be different to what was before. A journey of self-discovery can be really helpful rather than relying on somebody else finding out what that is for you. So encouraging people to do that independently as well as with a partner. There are lots of aids and support that can help with different elements of disruption or difficulty in terms of sex and sexual intimacy. So if there's less lubrication, using lubricants. If you've got some erectile problems, you might want to use some erectile function aids. But there's other ways as well in terms of thinking about that pleasure and intimacy around encouraging orgasm and sensation, which may be really disrupted or different now after surgery, radiotherapy and other treatments. Spontaneity is something that people often worry about or assume that sex should be spontaneous. I'd encourage people to think less about spontaneity and more about that interest and desire as a journey of discovery and exploration, and create some curiosity around what sex might look like now, what their sex lives might include that it didn't before. That's really important. If we all wait for that spontaneity, that can be really different after a cancer journey when we think about the other physical features that might disrupt that, like fatigue or other worries and concerns around function. Buying aids and lubricants and other things can be a bit daunting, but there are many ways to approach this, and we're going to provide some resources related specifically to people who've been on that journey after cancer treatment that might help you in your journey. So for people who don't have a single partner or who have multiple partners or want to have new potential partners, it can be a journey of understanding what feels right for you in those circumstances and situations, engaging with your normal sexual health checkups, that's important, but also navigating what are you going to communicate in those more casual relationships. And that might be very different to somebody who's in a relationship with one person. That's important. The journey is not about returning to the way things were before treatment. It's about feeling whole, connected, and embodied to yourself and others.